Hi, everyone. Welcome back to another episode of Making a Difference in Mental Health. I'm Danielle. Wendy's not here today. She's taking care of some business, but she'll be back for the next episode. In the meantime, I have a very special guest, one of my colleagues from our community schools team here in Prince George's County, Maryland, Mrs. Nikiah Wade, who is going to be here to talk about TF-CBT. She'll get into TF-CBT and what it means, but this is our modality series. And so I'm so excited to have her here today. Nikiah, hey girl, how are you?
Hi, Danielle. Thanks for having me.
Of course. So we want to go ahead and get right into our interview today. Again, we're excited to have you. What I'd like for you to do is just introduce yourself to our audience. And for the purposes of ABH, let them know what you do here at ABH.
Sure. So, as Danielle said, my name is Nikiah. I am a licensed clinical mental health counselor at Advanced Behavioral Health. I work as part of the PGCPS Community Schools program as a school-based therapist in an elementary school. I also see clients as part of the outpatient clinic.
Mhm.
I also see clients via telehealth.
Yeah, yeah. So we're part of the same team, community schools. We're in the community, as Nikki has already said, for the school system here. And we have clinic clients. And so we do a whole lot, Nikiah. We do a whole lot. But again, today is about TF-CBT. Can you explain to our audience who actually might just be interested in knowing a little bit more about therapy, but specific types of therapy? Can you tell us what TF-CBT is?
So, TF-CBT is trauma focused cognitive behavioral therapy. It is an evidence based treatment for children and youth ages 3 to 18, along with their caregivers. So, a supportive adult, it could be their parent, it could be an aunt. Typically, it's a parent, though.
Mhm.
And the treatment, it consists of several components used through 12 to 20 sessions where the therapist goes through each of the components with the
Yeah.
client. Initially, the sessions are time is spent with a part of the time is spent with the client going through that component, and another part of the session is spent with the adult individually. Um,
Mhm.
some of the components are like psychoeducation, parenting skills. In those initial sessions where you're meeting with them separately, you'll be going over the same component, but speaking to the client, who could be a 5-year-old child about psychoeducation as it makes sense to them. And then with the parent, the way that makes sense to them. Until you get to trauma narrative part. Once you get there, you are working with them on being able to tell their story, preparing the adult to be able to hear it. And then once the that part is finished, you'll have the child read the trauma narrative or show presented to their adult. But it's for children and youth who are having severe emotional response to a traumatic
Mhm.
life experience, such as a natural disaster, a sudden loss, or something like that.
Yeah. And you have given a lot of technical information about TFCBT. I think one of the most important things that you talked about is psychoeducation. And
Mhm.
so that's one of the reasons why we have the show here too, is for persons who are either interested in therapy, want to know a little bit more about therapy, or just want to be educated, whether they're caregivers or someone who wants to be a therapeutic client, to be educated from a therapeutic space, a clinical space,
Mhm.
about what they're going to be going through when it comes to getting back on the path of functionality. And I know this wasn't an original question, but can you kind of break down really quickly? Because I heard you say trauma narrative. I know what it is, but can you break it down in layman's terms before we get to the next question? What is a trauma narrative for someone who that might perk their ears and they might want to know what that is?
So basically, this form of treatment is gradual exposure. A lot of times, so common reactions to trauma, for instance, are having nightmares about the event or the traumatic experience, having flashbacks,
Mhm.
maybe having a difficulty focusing. So, and it's about that experience, right? That's what it's related to. So, as you're preparing them before you get to the trauma narrative, I feel like I need to explain that part.
Yeah.
you're preparing them to be able to tell their story, because people get stuck in that story and they like can't move past it, and it's causing them stress and anxiety. Once they get to the trauma narrative, what that is telling the story. It's typically, I would say, writing out the story, and the therapist may be narrating it and the therapist is writing it for them, but you're saying what happened, like what was the most traumatic part of that experience, what do you keep getting stuck at, what is bothering you the most about it. And there's also often a lot of guilt or shame about whatever the experience is, and so you're helping them work through. So cognitive coping is another part of the different components. But some people choose to maybe do a story about the event. Some people choose to do a picture. It may be a rap, some type of creative way of telling their story.
Yeah. I like how you're breaking it down for everyone, for us to know that therapy sometimes just isn't okay, the one, two, threes. It can get either creative in a way to allow our clients to be able to feel comfortable, like you said, telling their story.
Mm-hmm.
And so, kind of segueing into our next question, I hear that you're so passionate about TF-CBT. Can you kind of tell us a little bit of your journey of discovering it and your desire to actually get certifications in TF-CBT?
So I would say that I'm a strong believer in the power of thought. And as you know, like the cognitive triangle, how what you think affects how you feel and it affects how you behave. So I would say naturally, as a counseling student, when I got my degree, my master's degree in clinical mental health counseling, I was drawn to the theorists, therapy theorists like Beck and Skinner, who, the theories were around cognition and behavior. And so that, segues into me being drawn into CBT, which is cognitive behavioral therapy as a therapy modality. And then working with advanced behavioral health, they offer a training on TF-CBT. And I was like, wow, I'm working with clients who have gone through trauma, and sometimes you see behaviors and we dig in to see where the behaviors are coming from, right? It's often it's something down deep, something that's going on, something that they've experienced is why they're behaving this way. So I was seeing clients who had experienced trauma, and even as an African American, knowing about transgenerational trauma, all of those things that affect people, and they get stuck and they find it hard to live. I was like, I want to take this training. And then I got into training and I'm like, wow, this is awesome. This, I like person-centered therapy. I, think when you go in, we're working on what the client wants, but I also like that this is an evidence-based treatment that had components. So it's a structure that's there for you to go through with the clients. So I would say that's how I got into it.
Listen, you also hit on something that I think is a whole nother episode for a whole nother day when it comes to the culture piece of trauma and when it comes to people of color and trauma, but we're not going to tap into that today. But I really appreciate you even breaking down your journey. I mean, you're even talking about the forefathers of the modalities and different theories and Skinner, and long are the days gone where you would just lay back on the couch and just kind of talk about your feelings. But it's really interactive, and it's really, like you said, taking a deep dive to just explore. And so thank you for kind of just breaking that down to our audience. Now, when it comes to, because you said that you utilize CBT, which is cognitive behavioral therapy, and TF-CBT, when it comes to clients, because we do service a community within Maryland, within Prince George's County, Maryland, how effective would you say, during the therapeutic process is TF-CBT for your clients?
So of course, I'm only using it with clients who fit the, the criteria. So it has to be young people between the ages of 3 and 18. And they have to have had a traumatic life experience. So once I know that they've had a traumatic life experience or suspect it, then there's a screening. There's different screening tools that you can use to identify the trauma and whether or not they are experiencing symptoms based on that trauma experience. Because just because someone went through a traumatic life experience, both of us could be in the same experience, and the way
Right.
that I,
Mm-hmm.
react can be different from how you react. So once I identify that a client is having trauma symptoms, and then that's who I use it with. And I've found it very helpful in helping to normalize their experience and their reactions to the situation. Because there is a caregiver involved, it also provides them with parenting skills and information so that they can, because they also sometimes feel guilty, like, especially
Mm-hmm.
with things like sexual abuse. They're like, well, how come I didn't know? So you break that down for them. You help them provide the psychoeducation, parenting skills. There's also a component of safety planning and future development. So you're saying,
Mm-hmm.
like, how can we prevent this in the future, or how can we prepare and see the signs if something may be going on? So I find that it helps the family, not just the client, to move beyond and have some hope, and gives them tools to be able to cope.
Yes. And I was just going to ask you about that, about how this impacts the family as well. But like you said, it gives them hope. It gives them tools to be able to cope while their son or their daughter, or, whichever family member is receiving the TF-CBT, it is kind of like a domino effect where you see it impact the work that you do. You see it impact the family. And so I love that you said it does give hope. And that's really honestly what we're all about too. We're just, spreading news about psychoeducation, about mental health. And again, like I said, we could go into a whole nother episode for when it comes to mental health and minorities and people of color. So, thank you for that. And as we are coming to a close, we also always, always, always like to leave our audience with either tips or resources. And specifically because this episode is about TF-CBT, and it's more so, like you said earlier, focused in on trauma, or trauma experiences, whether they're direct or indirect. Would you happen to have any resources or tips for any individual who is either considering therapy or wants to support someone who's considering therapy?
Well, when it comes to TF-CBT, I would say, don't suffer in silence. If you know someone who has gone through a traumatic life experience and they are having a hard time with either that, nightmares, flashbacks, anxiety, or you suspect that they have been through a traumatic life experience, reach out. Of course, Advanced Behavioral Health, there's a number of agencies all over the DMV, and wherever you're watching from, honestly. But also, there's a lot of resources online. I feel like kidshealth.org has a lot of information. If you just want to know more about trauma and what are common reactions, for instance, they have information for kids, for teens, for educators, for professionals. As well as if you're a clinician who is interested in it, tfcbt.org has a place that you can start to find out more information. And then there's, we're in the digital age, there's information at the drop of a hat,
Right.
for people. Keyword search trauma. I would encourage people, of course, to look at reputable sources.
Right. Research people.
Yes,
Research.
yes.
Don't go down the rabbit hole. Wikipedia sometimes can, take you other places that you go. But like you said, yes, definitely research based, trauma information. So all of that is good. And you actually touched on something too, where what if there are some future therapists and counselors watching? And this could be a way for them to kind of hone in and narrow down on, wow, I've either been impacted, or like you said, you were so drawn to certain theories. I've been drawn to this CBT, and maybe go a little bit deeper, TF-CBT. So you never know who we are going to reach, but thank you so much for those resources and for those tips. Nikiah, this has been a great conversation. I, again, always enjoy speaking with you because we are colleagues. But thank you so much for being on the show. I believe that, this information here will definitely help, will support and encourage those who are listening on today.
Thank you so much for having me. I hope that people are out there, they learn something and they get help if needed.
Thank you, Nikiah, and everyone. Thank you for joining again for another episode of Making a Difference in Mental Health. I'm Danielle. Wendy will be back on the next episode. But until then, we'll see you next time. This is Making a Difference in Mental Health, and we're always striving to make a difference in mental health.
Bye.